Thank you, Sachi. Assalamualaikum and good day, everyone. I'm ATHIRAH binti Wan Ahmad HAZIM with metric number 066542, the first semester student, Bachelor of Law degree. According to a statement from Tan Sri Dr. Nur Hisham Abdullah, the Director General of Health, there were 70 reported maternal deaths due to COVID-19, 2 of which received a single dose of injection, and another 15 pregnant mothers did not receive any vaccine injection. Furthermore, he stated that no deaths have been reported in pregnant women who received 2 doses of vaccine injections. As we know, pregnant women will experience changes due to the presence of the baby in their body, not only physically but also physiologically, such as weight gain, blood content increases, increased water content, and so on. When these changes occur, the mother's uterus will enlarge after 28 weeks, which is 7 months of pregnancy, causing the lungs to be pushed, increasing the tendency of difficulty breathing if the mother and her fetus are infected. This condition, in combination with the risk of lung swelling caused by hormones progesterone and estrogen, is going to have a more devastating and huge impact on the mother and her fetus. Why? Because the enlarged contents will push the mother's lung and reduce the capacity of the oxygen. We know that COVID-19 is a type of germ that causes pneumonia, so if the pregnant mother's oxygen capacity is reduced, integrated with the possibility of pneumonia, how does this pregnant mother intend to fight it? That is a big reason why pregnant women are strongly advised to get the vaccination as soon as possible. So, now let us take a look at the link and safety importance of vaccine to these mothers. First, let's begin with the safety and the who. The vaccination program is running very smoothly as more pregnant women are now aware that they should get the vaccine shot right off the bat. Even so, some pregnant women refuse to be vaccinated, questioning whether it is necessary, can it be rescheduled, what if I take it after having a baby? Pregnant women must be reassured that there will be no complications for both mother and the baby when she gives birth. In fact, if a pregnant mother is not immunized and later contracts COVID-19, the risk to the baby is increases. We can see the statistics of pregnant women who died because they were not vaccinated or only had the opportunity to receive 1 dose of injection, according to a statement that I stated just now about the reported deaths of pregnant women. This clearly demonstrates that vaccination reduces the risk of pregnant women being infected with COVID-19 as well as the risk of hospitalization and ensures safety on it. Pregnant women were previously considered a high-risk group for COVID-19 infection because they carried 2 lives in their bodies and most likely had weakened immunity. Mother's body's immunity can deteriorate. This makes it easy for pregnant women to contract any type of infection, including lung infections, intestinal infections, urinary tract infections, and so on. During pregnancy, the pregnant mother's blood becomes more concentrated and easier to clot. This is done to prevent bleeding during labor and delivery. However, if infected, it affects and threatens the mother's fetus. Moving on to the secondly, pregnant women are advised to receive their first dose of the vaccine between 14 and 33 weeks of pregnancy. This is due to the need to protect women who are trying to conceive. This is also due to the fact that the fetus in the woman's body is growing during the first 14 weeks, which we fear will cause deformities in the baby. However, current research states that pregnant women can be vaccinated at any time, even after giving birth or breastfeeding. Talking about breastfeeding, some of the mothers are worried. Can a pregnant mother breastfeed her baby if she is vaccinated? Totally yes, breastfeeding is risk-free because it contains no living viruses. There is no possible mechanism by which any vaccine ingredient could enter your baby's system via breast milk. As a result, you should not discontinue breastfeeding in order to immunize against COVID-19. Besides, breast milk contains antibodies that aid in the defense of the baby against viruses and bacteria. Breastfeeding reduces your baby's chances of developing asthma or allergies. Lastly, let us take a look at other safety circumstances to reaffirm that vaccination is legitimately important to pregnant mothers. Firstly, it is necessary and advisable to get the COVID-19 vaccine if planning to be pregnant. Women who are trying to get pregnant do not need to avoid pregnancy vaccinations. Getting vaccinated before becoming pregnant can help protect against COVID-19 infection and its serious consequences. Secondly, to mothers who have allergies, women who have had an anaphylactic reaction or who have severe allergies are advised to consult a doctor first. Vaccination is guaranteed to be safe, and the good news is that there are an important group like diabetes and asthma where it is more important to get vaccinated because we know that when the disease is compounded by pregnancy, there is a double risk for her to become seriously infected. There is also a question, can a mother get the vaccine while undergoing an IVF treatment? Yes, you can receive the COVID-19 vaccine. Women are suggested to consider the timing of your vaccine, keeping in mind that some people may experience minor side effects in the days following vaccination that you do not want to have during treatment. It may be prudent to separate the date of vaccination from some treatment procedures, for example, egg collection and embryo transfer in IVF by a few days so that symptoms be correctly attributed to the vaccine of the treatment procedure. If you get the vaccine now, you will actually shield yourself and your baby from the effects of COVID-19 infection during pregnancy. All in all, this vaccination is completely risk-free. We know that since the onset of the pandemic, up to 200,000 pregnant women have received the COVID-19 vaccine, and not a single case has resulted in the baby developing any postnatal deformity, risk of miscarriage, risk of premature childbirth, or any variety of other possibilities. And 200,000 is a large number. Initially, there was no authentic data about the vaccine and pregnant mothers when it was advertised. But remember, we spoke about all the circumstances and the fact it all has a solution. So now that we have new data showing no negative effects of vaccination on pregnant women, all pregnant women are required to be vaccinated in order to save 2 lives. Now that you are enlightened about vaccination and pregnancy, my friend here, Sharvin, will talk about vaccination to those who have health problems. Thank you.